Narcissistic personality disorder, or NPD, is a complex mental health condition. It affects how people see themselves and others. People with NPD often have an inflated sense of their own importance. They crave admiration and lack empathy for others. This creates challenges in their personal and professional lives. NPD is not just about being self-centered or vain, it is a deeply ingrained pattern of behavior. This pattern impacts thoughts, feelings, and interactions with the world. Individuals with NPD might seem confident and successful on the surface. However, they often struggle with deep-seated insecurities and vulnerabilities. Understanding NPD requires a compassionate and informed approach. It is not about labeling or judging individuals. Instead, it is about recognizing the signs and seeking appropriate help. This can lead to healthier relationships and a more fulfilling life for those affected. NPD is often misunderstood, but it's crucial to remember that it is a real and treatable disorder. With the right support and treatment, individuals with NPD can learn to manage their symptoms and improve their lives. Narcissistic personality disorder manifests through a constellation of symptoms. These symptoms permeate various aspects of an individual's life. Recognizing these red flags is the first step towards diagnosis and treatment. One prominent characteristic is a grandiose sense of self-importance. Individuals with NPD may exaggerate their achievements or talents. They might believe they are superior to others and deserve special treatment. This inflated self-image often masks deep-seated insecurities. Another key symptom is a constant need for admiration. People with NPD thrive on compliments and validation. They may go to great lengths to seek attention and approval. This need for admiration often stems from a lack of internal validation. Empathy deficit is a hallmark of NPD. Individuals with this disorder struggle to recognize or understand the feelings of others. They may be dismissive, insensitive, or even exploitative in their interactions. This lack of empathy can lead to strained relationships and conflicts. Recognizing these symptoms is crucial for seeking timely intervention. Therapy can equip individuals with strategies to manage their symptoms effectively. Narcissistic personality disorder casts a long shadow over life. Its impact is pronounced in relationships and work. In romantic relationships, individuals with NPD can be demanding and controlling. They expect constant praise and attention. This can leave partners feeling drained and unappreciated. Workplaces can also become battlegrounds. Their inflated self-importance might clash with colleagues. They often take credit for others' work or refuse responsibility. The need for validation can lead to difficulties in relationships. Friends and family might struggle with the emotional demands. Individuals with NPD may not be aware of their impact. Therapy can help develop self-awareness and healthier interactions. When it comes to addressing narcissistic personality disorder, psychotherapy stands as the cornerstone of treatment. While medication might be used to manage co-occurring conditions like anxiety or depression, it does not directly target the core symptoms of NPD. Talk therapy provides a safe and structured environment for individuals with NPD to explore their thoughts, feelings, and behaviors. Through a collaborative process with a trained therapist, they can begin to unravel the underlying causes of their narcissistic traits and develop healthier coping mechanisms. Various forms of psychotherapy, such as psychodynamic therapy, cognitive behavioral therapy, and schema therapy, have proven effective in treating NPD. These approaches aim to help individuals challenge their distorted self-perceptions, develop empathy, and build healthier relationships. The journey of therapy for NPD can be challenging and require significant commitment from the individual. However, with patience, perseverance, and the guidance of a skilled therapist, individuals with NPD can make significant strides towards personal growth and improved well-being. Research suggests that narcissistic personality disorder is more prevalent in men than in women. While the exact reasons for this gender difference remain unclear, some theories point to societal expectations and cultural norms that might contribute to the development of narcissistic traits in men. NPD typically emerges in late adolescence or early adulthood. This is a crucial developmental period marked by identity formation and the establishment of interpersonal relationships. During this time, individuals are particularly vulnerable to developing personality disorders. It's important to note that NPD is a complex disorder with multifaceted origins. Genetic predisposition, early childhood experiences, and environmental factors are believed to play a role in its development. Further research is needed to fully understand the interplay of these factors. Early identification and intervention are crucial for mitigating the long-term impact of NPD. By recognizing the early warning signs and seeking professional help, individuals can learn to manage their symptoms and build healthier lives. It is not uncommon for children and adolescents to display certain narcissistic traits, such as seeking attention or wanting to be the center of attention. However, it is crucial to understand that these behaviors are developmentally appropriate in many cases and do not necessarily indicate a future diagnosis of narcissistic personality disorder. Childhood and adolescence are periods of significant ego development. Children are naturally self-centered as they learn to navigate the world and establish their sense of self. As they mature, most children develop empathy and the ability to consider the perspectives of others. A diagnosis of NPD requires a persistent pattern of grandiosity, a need for admiration, and a lack of empathy that significantly impairs an individual's functioning in various life domains. This diagnosis is typically made in adulthood when personality traits have become more ingrained and inflexible. If you are concerned about your child's behavior, it is always best to consult with a mental health professional. They can assess your child's development, provide guidance, and determine if any interventions are necessary. Narcissistic personality disorder is a complex mental health condition characterized by a grandiose sense of self-importance, a need for admiration, and a lack of empathy. It can significantly impact an individual's relationships, work, and overall well-being. While NPD is more prevalent in men and often emerges in late adolescence or early adulthood, it's essential to remember that not all individuals who display narcissistic traits will develop the disorder. Early identification and intervention through psychotherapy are crucial for managing symptoms and improving quality of life. Understanding NPD is not about labeling or judging individuals but fostering compassion and seeking appropriate support. By raising awareness about this often misunderstood disorder, we can create a more supportive and informed society that encourages help-seeking and promotes mental well-being. Remember, NPD is treatable, and with the right support, individuals with this disorder can learn to navigate their challenges and build healthier, more fulfilling lives.